So, I haven't gone to the dentist in about 3 years, and I've had access to dental insurance all of my working life. I decided one year in 2008 not to pay for the premium just because I didn't want to. Well, I went to the dentist for the first time about 3 weeks ago, and I found out that I have 4 fillings. I'm wearing my enamel down, and I need a bite guard. And these are things that I probably would have known a little bit sooner had I gone to the dentist sooner. But just like everyone else, sometimes I have to debate or weigh the options in terms of paying for my health expenses and feeling the after effects for months at a time. I mean, I just say, oh, I can get to it later, or I don't want to, or I'm in a recession, I don't want to pay. But I have access to dental insurance, and I'd be really disappointed if I lost a tooth, or even more seriously, I suffered something like a heart attack because of my poor dental health. Today, I'm going to talk about what a tooth is, some risk factors that go into avoiding the care of our teeth and our oral health, and the preventative measures that we can all take and just be reminded of that we should be doing on a daily basis. So the first thing we're going to talk about is a tooth and what a tooth looks like. And here's the tooth, and the white part you'll see is the enamel, and the enamel is the hardest substance in our body. It's the most durable part of the tooth, and it is also the most susceptible to bacteria. And that bacteria, once it penetrates that enamel, destroys the enamel and turns it into a cavity. And the one thing that we all may not be aware of is that once enamel is gone, your body cannot regenerate it, and it's the most protective outer layer of the tooth, so it's a really important part of the tooth. The next part of the tooth we're going to talk about, this pink area, is actually a softer yellow tissue called the dentin. It carries some of the sensory endings from the nerves. It's what helps you feel cold and hot sensations. And the next centermost part of the tooth is called the root, or the pulp. That is actually what transmits signals to the brain regarding our pain, and also is the way we get all the nutrients that we need for our tooth. Also, on the outer part here is going to be the cementum, and that is what covers the bottom part of the root, and in between the jaw and the tooth. And then in addition to that, you have the periodontal ligament, and that's the cushioning on the outside of the tooth. So if you see here, the gum in the red is the first place that you can look at to determine if your gums are inflamed. And gum inflammation can be a very good indicator of gingivitis, and that is a periodontal disease that's recognized by bleeding gums, swollen gums, and caused by overgrowth of tartar. And tartar comes from overgrowth of plaque and lack of flossing and oral health. The next phase of gingivitis would be peritonitis. Peritonitis is more severe, and there's an infection and pockets of infection below the gum. And both of these gum diseases can be precursors and can also lead to more serious diseases or conditions in life, 3 of which are heart disease, diabetes, and stroke. And everyone knows that if you're diagnosed with any of those 3 things, they're life-changing and life-altering. So in addition, there's some risk factors that are involved in that can contribute to poor dental health or gum disease. And one of them is smoking, and the other is a predisposed health condition. Also, we're talking about pregnancy can cause hormonal fluctuations, which contributes to the softness of your tooth, and just the lack of good eating habits. And these are things that can be good indications of whether or not you might be more susceptible to problems with your teeth. So one of the things that you can do is think about how can you prevent any diseases from occurring if you are not, let's say, predisposed to having a disease. Well, you can quit smoking for one. The nicotine robs your body of calcium. Two, you can reduce your stress. That reduces clenching and grinding. And three, you can have better eating habits and just better overall oral health. And what's oral health? Oral health is the preventative maintenance of your teeth. And some of the things that you can do are brushing with a soft bristle toothbrush at least twice a day with a fluoride toothpaste, and rinsing with an antibacterial rinse, and making sure you're flossing at least once a day to get rid of the plaque. And using these at least twice a day and for sure before bedtime can help you control the amount of bacteria that remains in your mouth for periods of time, and overall probably prevent possible cavities from forming as well. So in conclusion, just to make sure that you're better informed, you know what your tooth looks like and what it's made of and the importance of enamel, some of the risk factors involved and possible health problems that can come along from poor dental hygiene, and your responsibility in maintaining your teeth, brushing at least twice a day for 2 to 3 minutes at a time, flossing and rinsing. And if we can just all contribute to being proactive about our dental health, we can prevent or possibly curb any further damage to our own teeth. Thank you.